Okay, so the list of topics for cardiovascular in MRCGP OSCE. So, number one, acute coronary syndrome in emergency. This will include stable angina, unstable angina, and myocardial infarction. And you have to keep in mind the complications associated with MI as well. So there can be arrhythmias, there can be heart blocks, there can be cardiac failure, there can be pericarditis. Keep all those things in mind. Number two, stable coronary artery disease presenting in OPD for follow-up. Then you may have to deal with case of post-MI counseling. And in post-MI counseling, you have to remember many things, including the rehab, including the recovery, including the pharmacological indications, and you have to know about post-MI depression also. And also you may have to give advice regarding smoking and alcohol and all these things. So keep these things in mind also. Also you have to do in separate smoking cessation and alcohol dependence. These two cases are also very important. Then as far as BPH is concerned, it is basically not included in cardiovascular, but because the medications for the treatment of BPH, they are somehow related to CVS, so that's why I included it over here. So don't get disturbed by this strange topic over here. Then coming to chest pain, differential diagnosis, atypical chest pain, and then we have to handle various ECG presentations like lone atrial fibrillation, right bundle branch block. There can be various ECG changes in potassium disturbances, calcium disturbances. Then there can be an SVT in a previous ECG, and also think about the causes of long QT syndrome and do this topic as well. Then do arrhythmias in detail, and you should know about atrial fibrillation and SVT and risk factors for VTEC, etc. Then and you should also know a little bit about Holter monitoring and stuff like that, and heart blocks. Then coming to dyslipidemia, lipid modification, and also we have to read about the cardiovascular risk assessment and stuff, and metabolic syndrome, etc. over here. And we have to know the basic side effects of statin therapy and how we are following up the patient who is on anti-cholesterol medication. Then coming to hypertension, very important topic, white coat hypertension and the grades of hypertension. Then the complications of hypertension, including retinopathy and nephropathy with proteinuria. Then also we have to learn about hypertensive emergency, urgency, and the side effect of antihypertensive medications, and the compliance issues related to hypertensive medicines. And then coming to cardiomyopathies, hypertrophic obstructive cardiomyopathies, and TVT, PE, warfarin, and other anticoagulants, INR monitoring, and congenital heart disease, ASD, VSD, TOF, PDA, how we will counsel the mother of a child with these problems at specific scenarios and specific age groups. Now coming to the other topics like valvular heart disease, mitral stenosis, rheumatic fever, infective endocarditis, very important congestive cardiac failure, which can present acutely, and chronic congestive cardiac failure as well. Peripheral arterial disease, ABPI monitoring, palpitations, syncope, varicose veins, venous eczema, and venous ulcers. So all these are the topics for cardiovascular, and you have to focus on pharmacology and ECG reading, all these things. And if you cover all these topics with an open mind and keep your approach according to the examination criteria, I hope you will do very good. And with this video, take care. Inshallah, coming back next to you in the next video tomorrow with some educational material. This was basically the informative material because it was the list of topics only. And tomorrow we will cover a few topics from cardiovascular and endocrinology.